Hi, everybody. This is video 3 about knowing your rights as an individual living with a disability in a healthcare setting. I'm Jacob Pelagian. I'm a volunteer at the Los Angeles County Bar Association's AIDS Legal Services Project, and I'm joined here today by Sarah Pazeshkapour, who's a disability rights attorney and disability rights advocate, working in the disability rights arena for over a decade now. Hi, Sarah.
Hi, everyone. Hi, Jacob. In this video, we're going to address some examples of discrimination and discuss ways in which people with disabilities might experience discrimination. We will move on then to give you some tips and resources about where to file a complaint if you feel you've been a victim of discrimination. And a quick disclaimer before we get started. This guide is intended to provide you with accurate but general information about your rights regarding healthcare access in California. The information in here is current as of August 1st, 2020. This presentation is not intended to be a substitute for legal advice. And if you have questions or if you believe that you need legal advice regarding a specific concern or case, please contact an attorney or the appropriate agency about your rights.
When it comes to discrimination, the most overt form of discrimination would be a refusal to provide you with any services. But there can be more subtle ways of discrimination as well. These might include your clinician not responding to your reasonable accommodation request at all, your clinician responding to your request by refusing to accommodate you and failing to offer any alternatives, or your clinician might treat you differently from other patients. You can see we have several more examples on the slide, which you'll be able to download on our website.
Privacy is particularly important in a healthcare setting because of the stigma experienced by people living with communicative or cognitive disorders, mobility disorders, HIV, mental health issues, or substance use issues. Your protected health information, meaning your health records and diagnoses, test results, charts, prescriptions, and appointment records, should all be kept private between your healthcare provider and yourself. Before any of this information is released, you must be notified and you must have the opportunity to consent to the release.
On this issue, we have a list of relevant laws and links to resources in our companion PDF that you can check out.
There can be multiple other factors that you face in equal access to healthcare, including gender identity, sexual orientation, race or ethnicity, and it's possible that you might face discrimination based on more than one protected class. If you file a complaint or speak with an advocate, remember to inform them of all of the ways in which you feel you might have been discriminated against, which includes listing multiple disabilities if you are affected by more than one.
Individuals living with disabilities who are also people of color face even greater obstacles to accessing treatment, whether this be from systematic racism, language barriers, lack of insurance, or socioeconomic circumstances. And they may have higher levels of unmet health needs and greater distrust of healthcare professionals generally. This distrust is often exacerbated by the lack of healthcare professionals that the patient can relate to and the lack of services that are culturally relevant. We recognize the extra challenges and we want to encourage you to seek out the best care possible. Look into support groups and clinics in your area, as well as clinicians who deal with your specific type of disability. We've offered some resources for you to look into on our website, and we hope that you continue to try and create a healthy line of communication between yourself and your healthcare provider. Insist that they bring in the tools to help you.
We've talked a lot about the laws that protect you from healthcare discrimination, but what do you do when you're faced with discrimination? How can you enforce the rights that are afforded to you by federal and state legislation? In order for you to receive the level of care that you deserve, you must enforce the laws that protect you. There are ways to self-advocate and take action with government agencies whose job it is to enforce your rights.
First, you should keep in mind that you must act quickly if you think you've been a victim of discrimination, because there are deadlines, often just a few months after the event, in which you have time to file. Either before or after you reach out for legal help, try to create a written complaint as a reference for yourself and any potential investigators or lawyers who might be assisting you throughout the process. There are multiple government agencies you can turn to help you file an administrative complaint. There are also nonprofit agencies and private attorneys who specialize in discrimination. We have some listed here on this slide: the Department of Fair Employment and Housing, the Office of Civil Rights, and the Los Angeles Department on Disability, who's partnered with us on this project. If you are living with HIV, you can complete the online intake form for the AIDS Legal Services Project on our website or call 213-833-6776.
Disability Rights California, which is another leading organization fighting against discrimination, has created a page for consumer information for complaints about healthcare professionals, facilities, and programs.
Here are some legal references and professional peer-to-peer agencies that you can look into.
We'd also like to just touch upon a few things that are important to keep in mind during the current COVID-19 pandemic. The virus has made the disability community even more susceptible to acts of discrimination. In recognition of the disproportionate effect on so many communities who are already under-resourced and stigmatized, including and especially the disability community, we need to be vigilant as advocates and as a community. This makes it all the more important for healthcare providers and employers alike to address requests for reasonable accommodations. This is especially true if you suffer from health conditions that make you susceptible to COVID-19. Healthcare settings, particularly, are required to maintain safe, hazard-free environments by providing proper equipment and training to their employees.
There's also information available at Respectability, which you can find the link to on our website and our companion PDF. And Respectability has information regarding the effects of COVID-19 on the disability community and provides resources that may be able to help you or someone you know with some of the arising issues that people with disabilities face amidst the pandemic. This video is meant to provide you with an overview of the relevant protections and topics in healthcare discrimination, but we know that there may be many other challenges you're facing. There's so many other issues that you might be dealing with that we didn't cover here or in any of our other videos. There are also several accessible resources for you to research and potentially contact for your individual needs to be assessed.
Try your best to stay informed of new laws that provide you with additional protections or that change the way that your protections are applied. Even by simply watching this video, you've taken the first step of understanding your rights, and that's a huge step. Thank you for taking the time. And we hope that you download our companion PDF and look through the resources that we've compiled.
We also want you to check out some of our other videos for information about reasonable accommodations, communication issues, and vulnerable subpopulations. And with that, thank you for watching. Bye-bye.